All right, welcome. Welcome back to the Blue Veil Wellness Show. I'm Cristy Murray, Catholic nurse practitioner, and this is where we explore faith, food, and function because real wellness nourishes the body, mind, and the soul. Today's episode is one I've wanted to record for a long time. We're going into a territory that a lot of women think about privately, but rarely get to explore in an honest, informed conversation, and that is IVF. What the church actually teaches, why it teaches it, and what it means for women who are navigating fertility, loss, and longing. So this guest has been on my radar for a while. I met her when I was in Omaha for my NaPro and Creighton training, and she is just wonderful. She's so full of knowledge and wisdom, and she's a musician. She sings very well when we go to mass. So I'm glad that we finally made it happen. She brings something rare to this conversation, both rigorous theological information and a pastor's heart. So before I bring her on, I want to read her bio to you because her credentials matter and I want you to know exactly who you're hearing from. Sister René Mirkes, PhD, is a member of the Franciscan Sisters of Christian Charity and serves as the director of the Center for NaPro Ethics at St. Paul VI Institute in Omaha. A theologian with deep clinical experience, she brings together the rigorous scholarship, pastoral sensitivity, and a profound commitment to the dignity of the human person. Sister Renee holds graduate degrees in music, moral theology, and a doctorate in theological ethics from Marquette University. Over the past several decades, she has become a leading interpreter of Catholic teaching on procreation, reproductive technologies, and the ethics of women's health. Her writing has appeared in major journals and Catholic publications. She is widely sought after for her clarity, compassion, and ability to translate complex ethical issues into language that truly serves couples, clinicians, and clergy. We call on her all the time. So, whether she's consulting with physicians, accompanying couples through difficult moral decisions, or engaging in national conversations on emerging technologies, Sister Renee embodies the Franciscan spirit of truth, charity, and joyful witness. Welcome to the Blue Veil Wellness Show, Sister Renee.
Oh, this is absolutely my pleasure, Christy. Thank you so very much. Before we dig in, it's important to say that the exploration of the science and ethics of naprotechnology, I'm just being really honest here, is going to require a lot of brain power. And that power comes from synapses within our brains. And did you know, anybody in the audience listening or Christy, did you know that there are serious neurological studies out there that show that you can increase the synapses within your brain with a giggle, a chuckle, a belly laugh for sure. So let's see if these internet memes get at least a chuckle out of you with increased synapses as a bonus. This meme, for example, Saint Anthony asked God what he did to deserve an eternity of looking for everyone's car keys and phones and purses, etc., etc. Oh, that is so cute. This one, it's called the generation gap. Notice the hairstyles between the son and the dad are in exact reversible positions. We've got the boy, the son, hair on top and not so much on the bottom. We've got the dad with no hair on top with some on the bottom. And then this one. If you can't afford a doctor, go to an airport. You'll get a free x-ray and a breast exam. And if you mention Al Qaeda, you'll get a free colonoscopy. Oh my goodness. Christy, with those synapses snapping, I think we're ready for that first question.
Yes, thank you. I have a lot of questions for you, and I'm sure everyone is waiting. So, sister, I know what NaProTechnology is and IVF, but can we start with what is NaProTechnology and where is it headquartered?
Very good first question. NaProTechnology, first of all, is an acronym for natural, N-A, procreative, P-R-O, technology, NaPro technology. And we just call it NaPro for short. It's a dynamic, versatile women's health science that allows any woman to unleash the power that naturally exists within her cycle. NaProTechnology helps the woman to monitor and maintain her gynecologic and reproductive health. And this is no exaggeration, Cristy, when I say women, and I've been doing this for 30 years, women love NaPro for all sorts of reasons. First, it provides knowledge about how the female body, how the patient's or client's body is working. Second, it increases awareness on the part of the woman of any kind of abnormality she might encounter in her menstrual or her fertility cycles. And third, and I think this is extremely important, NaPro helps the physician, the nurse practitioner in your case, Cristy, understand the causes of a woman's health problems, inviting the woman to be a collaborator in her own healthcare maintenance. So, in short, or in sum, NaPro provides women real solutions to real problems, whether that be menstrual cramps or PMS, or ovarian cysts, irregular bleeding, polycystic ovarian disease, repetitive miscarriages, postpartum depression, hormonal abnormalities, or the issue that we highlight today, infertility. And my dear friends, NaPro does all of this by providing moral options for the anti-woman procedures of mainstream OB/GYN. Instead of contraception and sterilization, NaPro offers the natural system of family planning called the Creighton Model FertilityCare system. And Cristy, of course, is schooled and trained in the Creighton system. And instead of abortion, NaPro helps couples appreciate the beauty, the singular gift of every new human life, helps that couple, that woman, to view her baby as the perfection of marriage, the perfection of her family, and even the perfection of society. And on the topic of today's interview, instead of all the moral negativity of in vitro fertilization, NaPro has developed a whole alternative system of solutions for infertility that respect the full truth of human procreation and marital sex. Now, in answer to the second part of your question, NaPro is headquartered in Omaha, Nebraska, at the St. Paul VI Institute, and thanks to 43 years of training NaPro physicians and teachers, we have ancillary clinics throughout the United States and around the world. Dr. Thomas W. Hilgers, founder and director of the Institute, likes to joke that NaPro is on every continent except Antarctica, and he doesn't think the penguins need our reproductive health. So anyway, he has a tremendous sense of humor. But to be serious, Hilgers is a man who, like every other human being, has had to decide what it is that gives ultimate meaning to his life, what it is that's the font from which all his actions flow. And I can tell you, after 30 years of knowing Dr. Hilgers, that for Hilgers, the development of women's healthcare that conforms to God's plan for human procreation, a plan that really conforms to reason, and as a result, it's a plan that's unabashedly person, woman, family, and society friendly. Before we launch into a discussion of in vitro fertilization versus the NaPro approach to infertility, we need to describe what goes on in and during the in vitro procedure, and then contrast it subsequently to the NaPro approach to infertility. So, Cristy, I think we're ready for the next question.
Yes, absolutely. But I do want to piggyback on what you had talked about Dr. Hilgers and the NaPro training. So I'm proud to say I'm class 48. Yay, calling out to all my colleagues. And I wish I had brought this or I learned this method sooner. So now I am the first NaPro consultant in Alaska and the Creighton Fertility Care practitioner as well. I just wish, because me going through infertility myself a long time ago, I wish this was available to me. And I am just grateful that Dr. Hilgers developed this method, grateful to Sister and to all the staff of St. Paul Institute, making this available to all of us practitioners and medical providers. So yes, Sister. So now let's talk about, can you tell us what is in vitro fertilization and what procedures does it involve?
Yes, that's a logical question to ask next. In vitro fertilization, to put it in one sentence, is the production, notice I didn't say the conception, I said the production of a new human being in a petri dish in a laboratory, apart from the intimacy of its parents' marital act and apart from conception in its mother's body. Now, there are 5 steps, I call them procedural phases of the in vitro process. And the first phase is ovarian stimulation. The female patient takes injectable hormone medications to encourage the entire group of that cycle's eggs to mature simultaneously and fully. This means instead of having just one egg, as in a natural cycle, in an IVF cycle, the patient may have many eggs. The patient's response to the medications is monitored by ultrasound and also by blood hormone levels. When the patient's eggs are ready for final maturation, a trigger shot is given to finalize their maturation in preparation for egg retrieval. Somehow we have to get those eggs out of the woman's ovaries. Now, we should note that this step is not without its health risks. Ovarian hyperstimulation syndrome could result in possible rupture of fallopian tubes and then related risks to both maternal health and life and fetal health and life. The second step of IVF is egg retrieval and sperm collection. The healthcare provider uses ultrasound to guide a thin needle through the patient's vagina into each of her ovaries. The needle is connected to a suction device, which is used to pull those eggs out of each follicle. The eggs are then placed in an incubator, first in a petri dish and then in an incubator. To collect the man's sperm, the patient's husband or the male partner retrieves sperm by penile stimulation. The semen are taken to the lab, washed, spun down, made rich before fertilizing the woman's egg. The third step of IVF is fertilization. The afternoon after egg retrieval, the embryologist tries to fertilize all mature eggs using a long term here, intracytoplasmic sperm injection, or ICSI. This means simply each sperm will be injected into the cytoplasm of each mature egg. On average, 70% of mature eggs will be fertilized in any given IVF cycle. So, for example, if 10 mature eggs are retrieved, about 7 will fertilize. If successful, what we've got to remember is that the fertilized egg is the first cell stage of a human embryo, which is to say that single cell zygote is the first cell stage of a human being. The fourth step of IVF is the culturing of the embryo. How does the embryo development proceed? Development of the embryos is really carefully monitored with time-lapsed incubators that have built-in cameras that take pictures of the embryo every few minutes. Embryologists can see the embryo's development over time, from the moment of fertilization through key stages of growth. Usually, 50% of embryos fail to develop, and they're discarded. The patient could also opt for all sorts of genetic screening, monogenetic and polygenetic screening. With the destruction of any of the embryos, listen carefully, who do not pass these genetic tests. In addition to genetic screening, the patient can also opt for designer features to be put. In other words, they could design their embryo. Features like eye color, hair color, height, athleticism, intelligence, gender. There is an IVF center in Dubai, Qatar, called Orchid, and it labels itself as, quote, the world's most advanced whole genome screening for embryos during IVF, end of quote. Orchid uses AI-generated polygenic embryo testing. Parents who opt to use this option, now it's an option, and not every parent that goes into IVF, not every patient that goes into in vitro opts for this, but many do. So those who do get an extensive analysis of their embryo's risk for a variety of health conditions, including but certainly not limited to things like autism, severe obesity, Alzheimer's, inflammatory bowel disease, schizophrenia, diabetes, and even breast cancer. Understood, but not always stated. Embryos will be destroyed if, in fact, they exhibit risks for these diseases. So couples contemplating IVF could destroy their embryonic baby if it's at risk for something as manageable as severe obesity. Terrible, really, when you think about this. The fifth procedure is embryo transfer. So how are we going to get the embryos from the incubator into the woman's uterus? There are actually two kinds of transfer, fresh and frozen. A fresh embryo transfer means the embryo is inserted into the patient's uterus between 3 and 7 days after the egg retrieval procedure. This embryo hasn't been frozen, and therefore the procedure is called fresh transfer. A frozen embryo transfer means that frozen human embryos, cryopreservation is part of in vitro, from a previous cycle are thawed. Now, you think we were talking about an ice cube here. This is a human being in its embryonic stage. They're thawed and then inserted into the patient's uterus. And frozen embryo transfer is a more common practice because it has been shown that frozen embryo transfer has proven more likely to succeed than the fresh.
That's
The
interesting.
last and possibly non-occurring step of IVF is pregnancy. The healthcare provider is going to use a blood test to determine whether the patient is pregnant, approximately 9 to 14 days after embryo transfer. So they're defining pregnancy by implantation and by 14 days after the embryo transfer. If that embryo has implanted in the endometrial lining of the uterus, it will show up. So when we talk about success rates for IVF, it's very difficult to generalize, Cristy, since the rate of pregnancy depends on the individual woman's health, her morbidity, what diseases she has, and her age. And it really depends on age primarily. Usually, what we can say is the generalized rate of pregnancy with IVF is somewhere between 25 to 30%. That means, think about this, IVF fails to get a woman pregnant 70 to 75% of the time. Now, Cristy, that was a long answer. Have I replied to your second question adequately?
Yes, you have. That's a very good visual on each step of IVF. I don't think a lot of people are aware of it as well. I do have something to piggyback on it though, and I just blanked out. The success rate. Oh, okay. So it sounds like that IVF has been commercialized. It's consumerism, like babies become a commodity. And I just wanted to share that some patients or some people that have gone or were going through IVF or gone through IVF, I asked them, are you being taken care of in other way? Are they asking you about your diet, about your lifestyle, or your stress or anything else? And it's a really sad response that I got was, nope, we just show up, they take our money and they do the transfer or they do whatever they need to. So it really, there's no connection. There's no like
Personal
provider patient
interaction.
connection.
Yeah.
Yeah.
Yes, that's very sad. Very. I found that same thing in my 30 years of dealing with clients that come from IVF to NaPro. They say very similar things, very similar reactions. It's very impersonal, almost anti-personal, and the big emphasis is on the money. They want to get your money. And that's
Yes.
the first thing that they grab for.
Yeah.
Yes, it's very sad,
And you had
actually.
mentioned they have all these other options if you want this. So then it adds, let's add this to your shopping cart. If you want ICSI, let's add this. If you want genetic testing, add it. So then here's your total. But
Yes, definitely. I agree.
so now let's proceed to what does the Catholic Church and its natural law teaching, what do they define the morality of how do they define the morality of infertility treatments?
Yeah, the Roman Catholic Church's teaching on the morality of infertility treatments is not, first of all, I want to say this, I want to underline this, is not some private truth for Catholics only. No, this teaching is based on natural law, the law of human nature, which is the law of reason. So that means that the truth of this teaching is truth for anybody, Catholics, atheists, Muslims, anybody who has the ability to reason and can recognize reasonable directives and conclusions. Donum vitae, two Latin words that mean the gift of life, is the title of an instruction from the Vatican that treats the morality of infertility treatments. And it teaches that an infertility procedure could be morally licit if it assists the act of marital sex to achieve a pregnancy. Emphasis here is the word assists. While a procedure such as IVF that replaces the sexual act is immoral. So you will notice in the first question, where I broke down IVF according to its procedural phases, there was nothing said that the couple engage in an act of marital intercourse. Nothing. And there is no act of marital intercourse. IVF replaces that sexual act. So here's what the church is saying by that root principle. The only context worthy of the conception of a new human being is within that marital act of reciprocal self-giving love of its parents. The church insists the central moral deficit of IVF lies in the fact that it replaces rather than assists the act of marital love in achieving a pregnancy. That's its principal moral deficit. And no matter what you do or do not do, whether you just create one embryo and just transfer that embryo to the woman's body, and there's no death of the embryo involved, every act of IVF, even in its simplest form, involves the betrayal of this principle that all human life should be conceived within an act of marital self-giving love between parents or between husband and wife. With IVF, the husband and wife generate a baby or produce a baby in a sterile laboratory instead of within that reciprocal self-giving act of sexual love. It deprives, my dear friends, the newly conceived IVF baby of the intimacy of its parents' act of love, as well as excludes the baby's conception from within his mother's body. You might ask, oh, really? Is that so bad if you replace the act of intimate love between husband and wife with the laboratory procedure? Is that really so bad? Yes, it's very bad. And to appreciate the moral wrong of conceiving a new human life, a baby, in a lab rather than within the act of marital intercourse, we need to step back, my dear friends, and take a look at the relationship of love and life in God. God's creative love, by its very nature, is altruistic. It has to go out of itself. God's love had to be shared, poured out in giving life to others. That pattern, a love that is at once life-giving, becomes the model, my dear friends, for all human love, and most specifically for marital love as it procreates a new human being. Just as God's love reaches its perfection in giving life, so must married love. New human life, conceiving a baby, a new human being, only makes sense, teaches the church, within the context of a loving act of marital sex. The only setting respecting the dignity of human conception is that act of marital sex, the intimate act of reciprocal self-giving love between husband and wife. That setting, and that setting alone, defines every baby as a gift rather than as a product, a somebody rather than a something, as in IVF. The child is not, nor should ever be, a showcase for its parents' personality and preferences, but a blessing from God, a child who deserves love and a chance to grow up regardless of its risk for irritable bowel syndrome or obesity or any other disease. A new human baby must be recognized as a good, a blessing, a gift, independently of the desires or the wishes of his or her parents, and independently of any parental design. to use God the Creator's declaration in the book of Genesis, the existence of every newly conceived baby is and must be seen as very good, as a very good gift, to be loved just as they are, not as we wish them to be, not as they are free from every genetic disease in the book. No, but just because that baby exists. In contrast, IVF parents make the life of their child depend on their desires, on their will, and therefore on their power. Ouch. Their power to make or invent the lab simulation of the biological aspect of human conception misleads the IVF parents into thinking they own their baby, creating a relationship between themselves and the baby that's just riddled with gross inequity. The IVF child could think and, in effect, could say to his parents, I came to be only on the condition that your desires for a baby would be satisfied. That child, once he's old enough to reflect on his beginnings, might also think, you know what? I exist to vicariously fulfill my parents' hopes and dreams. But this sort of existential dependence, my dear friends, would contradict the child's fundamental equality with his parents, equality with all other human beings. That's why, based on the natural law, the law of human nature, the Roman Catholic Church teaches any reproductive technology that assists rather than replaces the conjugal act to achieve conception could be morally acceptable. Here's the good news. NaPro, infertility procedures, which we'll be discussing in just a minute, unequivocally assist the act of marital love to achieve its natural goal of pregnancy, and therefore are a morally good example of assisted reproductive technology. But now, if you would give me just a minute, Cristy, I'd like to go back to IVF because I want to handle what I call its secondary or ancillary evils. The first evil, of course, is procreating or producing a new human being apart from the unitive meaning of that marital act of sex. That's the first primary evil. These other evils, which some are very serious, are not always present in every act of IVF, but they are in most. First, creating spare embryos. This is done to guarantee enough embryos to transfer to the mother's uterus after pre-implantation testing. So pre-implantation testing might end up destroying some of those embryos because they didn't pass the test. And this means that if one or more of these human beings in their embryonic stage fail to meet the selective screening criteria, they are going to be destroyed. Second, the cryopreservation. I already alluded to this, or the freezing of embryos, condemns the IVF baby to a surrealistic suspension in liquid nitrogen until further directives come, either from their parents or from IVF cryopreservation units, to let them thaw. How sad. The option of donor egg or sperm for couples who do not produce their own gametes or whose gametes, egg and sperm, are subject to abnormalities that are inimical to normal conception is another secondary evil of IVF. This practice destroys the moral unity of the couple who are trying to conceive by introducing egg or sperm from someone outside their union, and produces babies who are not, and this is the saddest thing, they're not entirely genetically related to their rearing mother and dad. Another ancillary evil of IVF is the option of hiring a surrogate mother. Surrogacy, is currently a common option offered by many IVF clinics. This practice is not only an injustice against the surrogate mother, but denies the baby its right to be conceived, listen carefully, gestated, and born into a marriage of its rearing parents, the parents who are going to raise the child. Another possible ancillary evil of IVF is the production of a baby designed by its parents. I've already talked about this. Options of choosing the baby's gender, hair color, eye color, height, intelligence, or athleticism, and also the chance to screen a baby so it will not be plagued by some common genetic diseases. So I'd like to ask you a question, those who are listening in the audience. What's the moral fallout from all of this parental dictation of characteristics of their baby? Think about that. These evils change the baby, in my opinion, from a human being to be accepted as they are into a product, a thing, an object whose dignity is trivialized and disregarded by clinical and parental design, implying, and here's the real evil, that having a baby is a right, RIGHT, something to be had on demand and designed by parental choice. Okay, Cristy, if you think I've answered that third question adequately, I think we are ready for more questions.
Yes, I do have another question, but I also wanted to share that I am part of a women's group that we meet once a month, and we had talked about like all these issues before. And there was a study actually, I think in 1 month, one of the ethical issues that we discussed was surrogacy. And so there's studies that because there's certain hormones when the baby's born, there's supposed to be that bonding phase. There's certain hormones that get released by the mother and by the baby, and they're supposed to bond. That's why it's really beautiful. As soon as the baby's born, the baby's handed to the mom. But that does not happen in surrogacy. So in surrogacy, as soon as the baby's born, the baby is given to the, let's call them the ordering parents, right? Because they're not, are the genetic parents. And later on down the road, they're finding that because of these loss of hormones during the bonding phase when the babies are born, a lot of issues come up, emotional, mental issues with these babies that are almost pretty much being ripped away from the birth mom.
That's really very good information to keep under our hats and under our veils.
Yeah,
Something we
there's
really need to think about. And we could go through each of these ancillary evils of IVF and come to some emotional trauma that's caused to mother, baby, parents, society by doing these ancillary evils.
Yes. So another question I have is, so what is the NaPro technology approach to infertility and what makes it morally good? Let's talk about positives.
Yes, let's end with that positive note. The entire treatment program for infertility is built around a Creighton Model FertilityCare chart. That is the Creighton Model FertilityCare chart that the woman produces from making observations during her menstrual and fertility cycles. And this chart is very important for the initial evaluation of a couple's fertility potential, for the timing of blood tests, and another reason to monitor the response to treatment cycle by cycle. The beneficial effects of medical and surgical treatments can actually be seen, and I'm sure you've seen this, Cristy, as the chart changes from an abnormal to a normal pattern.
It's amazing.
Thus, when functional reproductive abnormalities are causing infertility, I don't know, ovarian hormone deficiency or ovulatory defects, they might be corrected with medical treatments only. Infertility that's grounded in structural defects like endometriosis, PCOS, pelvic inflammatory disease, uterine fibroids, endometrial polyps, uterine septum, might necessitate specially designed NaPro surgical interventions. Yes. And then, if stress is an issue, the beneficial effects of counseling and stress management can be seen from improved charting patterns. So the woman, the couple, and the doctor keep going back to the charts and saying, we did this treatment, we did this surgical intervention, and we are seeing the positive results in the way the chart looks. It goes from abnormal patterns to normal patterns.
Yes.
So whatever NaPro infertility protocols might be, they all embody the small c or universally true realities that Vatican teachings proclaim. All the while, NaPro infertility protocols avoid the moral defects of IVF. First, natural procreative technology and the infertility protocols developed and practiced here at the St. Paul VI Institute and all over the world in the United States assist, not replace, the marital axilla. So they fulfill that very first principle. Recall, the slide said, the Catholic Church teaches that if infertility procedure assists the act of conjugal love, it could be moral. And that's exactly what NaPro infertility protocols do. Second, they promote the unitive love meaning of the marital act of sex that's not only inextricably linked to, but that alone makes sense of the mystery of sexuality and human procreation. Third, NaPro infertility protocols recognize, and this is so beautiful, recognize the child's right to be conceived, gestated, born into, and raised within a heterosexual until death do we part marriage. Fourth, NaPro infertility protocols respect the inviolable integrity and right to life of a newly developing baby. There's no killing of embryos with NaPro. Absolutely not. Fifth, NaPro infertility protocols acknowledge the truth that parents ought to view their baby as a gift, not a right. In sum, NaPro's infertility protocols provide an infertile couple with medical and surgical treatments that not only identify the root causes of their infertility, but also are moral in nature. That is, respect the dignity of the patient and the couple, something IVF procedures simply cannot and do not offer. NaPro infertility protocols justly respect, I am proud to say, and recognize the child as someone equal in personal dignity to its parents, because the sexual act of unitive love is the only reproductive context in which parents are able to welcome and love their child unconditionally as someone whose mere existence is already in and of itself a good. In closing, I've included my email address in case any of you listening have questions about something that I've said. So you can email me at ethics@popepaulvi.com. And any questions that maybe were raised by Cristy's comments, you can email Cristy at info@blueveilwellness.com.
Yes.
I would like to add just one footnote about pregnancy rates with NaPro. More than 60% of patients treated with NaPro protocols according to one study, became pregnant within 24 months, that is, within 2 years. And nearly 70% of those NaPro infertility couples became pregnant within 36 months, 3 years. So yes, it may take longer to get pregnant with NaPro, but it certainly is worth the wait and worth the time. So I just thank you, Cristy, so much for inviting me. And it's been a real delight to share this with all your listeners. God bless
Yes, thank
you.
you. So sister, you said so 60 to 70%, either 24 to 36 months compared to the 30% of IVF and 20,000 something dollars and a lot of ethical issues. So I think this is a no-brainer, right?
I think you're right.
Thank you so much, sister, for sharing your knowledge with us, helping us be more aware, and with your experience and your education, it really means a lot coming from you that you present this information to all of us. So for our listeners, if you have any questions, like sister said, I will include everything in the show notes as well. And yeah, you can either send her an email or send me some questions. So I do want to say that when sister earlier was talking about the charting that we can see, and it's more precise for the woman, and it's a really amazing tool because we time the labs based on a woman's cycle. Because I'm both Western medicine trained and now that I'm learning NaPro, it's really precise timing of labs. So then we can see really what's going on in your specific body. And just looking at the charts, like sister said, we can identify a lot of issues that are otherwise being masked by other technology. So we really do go to the root cause. And like she had mentioned, it's that 60 to 70% increased rate of pregnancy is amazing. And even if you're not trying to get pregnant, just being aware of how your body works so you can stay healthy all throughout your life, even until menopause.
So
So
important.
yeah,
Yes. And Cristy, we women really want to know what's going on in our bodies, don't we? It's a natural instinct in every woman. I wonder how my body is doing. It's so important. And this system, the Creighton Model Fertility Care System, is absolutely amazing in what it
yeah.
shows a woman. Absolutely amazing.
Until next time, we'll see you again on the Blue Veil Wellness Show.